Hey guys, this is Dr. Hub. Today we'll look at the classification. So we're going to classify the muscles, and this is totally according to their shape and directions. So all muscles have a different shape and directions, and we're classifying them. The first one being in terms of the parallel fasciculi. So in terms of the parallel fasciculi, it includes, there is a quadrilateral. So in terms of the quadrilateral, there is the thyrohyoid. The thyrohyoid is in terms of the quadrilateral. Then we look at a strap-like. So a strap-like is going to be sartorius. Sartorius, as you can imagine the shape, it is strap-like. And then there is also the sternohyoid. Next we look at the strap-like with tendinous intersections. So it is strap-like, and this is with tendinous intersections. So strap-like with tendinous intersections, this includes the rectus abdominis. There is rectus abdominis. Next we look at the fusiform. So fusiform, this is the famous muscle. In fusiform, it is the biceps brachii. Biceps brachii, and also the presence of the digastric. So quadrilateral was thyrohyoid, strap-like was sartorius, sternohyoid. Then strap-like with tendinous intersections was the rectus abdominis, fusiform being biceps brachii and digastric. Next we move on to the muscles. Muscles with the oblique fasciculi. So in terms of the muscles of the oblique fasciculi, there is a triangular. So triangular means it is temporalis. So muscles with oblique fasciculi. There is temporalis as well as there is the adductor longus. There is temporalis as well as the adductor longus. Next we move on to the unipinnate. So in terms of unipinnate, it includes the extensor digitorum longus. Extensor digitorum longus in short is known as the EDL. Then there is also the flexor pollicis longus. So we are writing as the FPL. So it is extensor digitorum longus as well as flexor pollicis longus. Next what we have is the peritoneus tertius. So there is peritoneus tertius as well as the palmar interossei. Palmar interossei. Next we move on to the bipinnate. So in terms of the bipinnate, it includes the RF. So what is RF? RF stands for the rectus femoris. So let's write it down, rectus femoris. And then there is also the FHL. FHL is nothing but the flexor hallucis longus. So all this is bipinnate. Then there is also the PL. PL stands for the peroneus longus, as well as the DI stands for the dorsus interossei. Dorsus interossei. Next we look at the MP. MP stands for the multipinnate. So under multipinnate, it includes the deltoid. So multipinnate has the presence of deltoid as well as the subscapularis. So the triangular was temporalis and adductor longus, and here in multipinnate it is deltoid and subscapularis. Next we look at the circumpinnate. So under circumpinnate, it is the tibialis. In under circumpinnate, it is going to be the tibialis anterior. Next what we see is, we will look at the muscle with the spiral or twisted fasciculi. So there is muscle, and this is with a spiral or twisted fasciculi. So under the muscle with the spiral or twisted fasciculi, first we look at the spiral. So under spiral, this includes the pectoralis. So it includes the pectoralis major. Then it also includes the latissimus dorsi. So it includes the pectoralis major, latissimus dorsi. Next, it also includes the supinator. So there is supinator as well as the presence of the trapezius. Next we look at the partially cruciate and partially spiral. So partially cruciate Cruciate means it is a plus sign, as well as partially spiral. So partially cruciate and partially spiral, it includes a masseter. So there is masseter. There is also presence of the adductor magnus, and there is a SCM, that is a sternocleidomastoid. So partially cruciate and partial spiral, this is important. There is masseter, adductor magnus, as well as presence of the sternocleidomastoid. Whereas in terms of spiral, it was pectoralis major, latissimus dorsi, S4S, spiralis supinator, and the presence of trapezius.